Well, welcome back to Great Day, Washington. Chronic pain can make the easiest daily tasks more difficult, but you don't have to live in pain.
Start the path to pain-free living with Dr. M. Scott White, D.C. He's the founder of New Life Laser. Welcome back, Dr. White.
Thank you.
Welcome.
Oh.
Thank you. Hey, I want to talk about that laser, but first, can you put up a picture? I took this picture on a little vacation I had over the last weekend. Got a picture of a window? There we go.
There it is.
I'm going to let you guys see it up close.
Okay, yeah.
Now, this is what I want you to do. Did you get a good look?
Yeah.
Yes.
Okay.
Yeah.
Now,
Yes.
how is this window like our patients at New Life Laser? Don't answer now.
Okay. Well,
At the end of the segment.
Gotcha,
Because
okay.
There's going to be prizes given out.
there are prizes.
Okay.
I know that you love vegetable gardening, Marquette. Am I correct?
Yes, you are correct.
Okay, so you can't touch them until you win, but
Okay.
there's carrots and, and green beans. Now, I know that you love to fly airplanes.
I do. Hey, look at that.
Okay.
The 3 airplanes.
This is kind of flying stuff. So again, end of the segment. But I want to talk about robotic deep tissue laser.
Okay.
32 years of practice. It's the most incredible tool I've ever seen for getting rid of pain. But more than getting rid of pain, it actually does something to cause stem cells to regenerate and heal and proliferate. So that you're not just getting rid of pain, you're actually doing something to cause your body to heal. We can do it on all different types of the bodies, all different areas of the body. What's the #1 area that people have pain?
Back.
I'm thinking back, yeah.
We run 86 to 92% success helping people with disc herniations, disc bulges, spinal stenosis, any type of back pain, any pain in the body, any joint. But what's the second most common area for people to have pain?
What do you think? I'm going to say knee.
I was going to say neck. Knee?
Knee,
Okay.
you got it. So knees are a big deal.
It's all because we walk upright. I mean, we should go back to the old days, you know, on all fours, just crawling around. No, that's not your...
That would be more of a problem.
Oh, okay, good.
So anyway, no, basically the situation is that we can use this laser on any part. Knees, a big deal. I mean, nowadays it's like knee replacements, right?
Right.
But you can't get them until you get old enough. So you suffer with knee pain until you get old enough and then major surgery. You know, people don't realize major surgery is something we need to try to avoid. Spinal surgery, 50% failure rate, 30% complication rate, meaning, you know, maybe there's, you know, a problem with a severed nerve or maybe an infection, you know, and 1 in 2,000 people meet Jesus. So, you know, if we can stay away from it, if there's a better way, like using this robotic laser, that's what we want to do. Knees, hey, they're great if you have to have a knee replacement, but it's major surgery, and 1 in 400 people die within 30 days of having a knee replacement.
Wow.
So I'm not trying to scare people, I'm just saying there's an alternative. You know, we see over the last 9.5 years, we've seen thousands of knee patients, and to my knowledge, I've only had to have 3 patients have knee replacements in all those years. So even if it's bone on bone, we get most of our patients 40 to 70% better, and it stays.
Wow,
So,
that sounds so painful, bone on bone. What about some of your patients who maybe they've been on medication for years, and then you mentioned the severe cases where there's not a lot of cartilage in there?
yeah, you know, I love to see the patients that have been in and they've had these problems for years and years. They've tried the medications, the steroid shots, have even had surgery, and I'm just telling you that it's really like a miracle for most people. You know, 86 to 92% success with back problems, 40 to 70% better with knees. So it's just an amazing procedure with no downside. It's transdermal. There's no cutting. There's no tissue destruction. There's no pain. And it's just an amazing way to get out of pain, but also do something to turn on stem cells, cause tissue healing, so that, you know, the vast majority of our patients never have to come back for the same area that we treat. So that's exciting.
That is exciting. You're doing something out there.
Yeah.
Good. When you get out of surgery, you feel horrible. When you get out of doing what you're doing, the robotic laser, you feel...
Great.
There you go.
So
Just
listen.
like Great Day.
Okay, can we put the picture back up?
Yes, picture back
okay, now
up.
here we go. Drum roll.
All right. How is this like your patients?
You're supposed to tell me.
Oh, I
You
don't
wanna win the
know. Because they're fragile as glass.
Wait, no.
Broken.
No.
Missing something.
Yes.
Oh.
What is it missing?
A window pane.
Missing the pain.
Yes.
Oh. So she gets the vegetables. I don't get my little fly stuff.
Categories.
Here,
I
there
haven't
you
played
go.
that in a long time.
Oh, well.
Thank you.
You're welcome.
Well,
Look
good
at
for
that.
you if
So
you're
look,
out
we
of
wanna get
pain, but I don't
people
get
out
my
of pain.
toy.
So here's what we can do. We want to call 1-888-PAIN-FREE. That's 1-888-PAIN-FREE. Now, we've got people standing by for the next 2 hours. If you call that number, we're going to do a completely no-charge first visit in any of my 6 area locations. So we have Woodbridge, we have McLean, we have Bethesda, we have Arlington, what am I missing? Fairfax, and Woodbridge.
Good.
So basically, call that number, 1-888-PAIN-FREE. They'll tell you and direct you to the closest clinic. And you'll come in, meet with us, we'll sit down with you, bring x-rays, MRIs, reports, anything you have. We'll do 2 free laser treatments, and most of our patients feel better even after the first laser treatment. So.
Excellent.
Thank you so much, Dr. White. And thanks for my urban vegetable garden.
I get this anyway. That's great. And by the way, you might not get this if you go see Dr. White. You have to answer the questions.
So you don't have prizes in your office? No?
This is not special for you, Marquette.
Thank you. Thank you, and thank you. And after the break, we're going to say